Hi, I'm Kelly Hall. This is Component 4, Professional Values and Goals. I have been working as an RN for a year and 9 months now. I work in a long-term acute care center, which I like to describe as a step-down ICU because a lot of people don't understand what a long-term acute care hospital is, or an LTAC. I have a lot of examples and experiences in my work thus far that I can use to build my nursing philosophy. The beauty of a nursing philosophy is that it's ever changing. It's going to be ever changing throughout my nursing career. I have what I think is a start to my nursing philosophy based on experiences I've had. But I am knowing and I'm willing to accept the changes that will come to my philosophy throughout my years as I grow as a nurse. I'm going to talk about a few experiences that I've had first, and then I'm going to explain how these three experiences have helped me build what my nursing philosophy is thus far. So, my first experience, I go into my patient's room after getting report in the morning. I notice they're having excessive belly breathing. I know they're on CPAP. So I ask the respiratory therapist, can you place the patient back on the assist control on the vent? They're breathing super hard and it looks like they're struggling. We put them back on. Now the patient's vent keeps alarming, high pressure, which we like to call bucking the vent or fighting the vent. The patient now looks uncomfortable. He's diaphoretic. I ask him, are you having any pain? He nods his head yes. So I go ahead and I administer him his PO pain medicine that he has. After about 15-30 minutes, the patient still isn't any more calm. They're still fighting the vent. So I asked the doctor, hey, can we have an order for Ativan for this patient? He's just really fighting and struggling in there. So I give him that. He still isn't calm. I re-listen to his lungs again. They're still rhonchorous, anterior, posteriorly. I check for any subcutaneous emphysema. I didn't know any. At that point, I collaborated with the NP and the doctor. We got a stat chest x-ray. This patient is having excessive pulmonary edema. So we had no option at that point but to start him on a Versed drip because he was just fighting the vent and at this point just needed to calm down before he wore himself out too much. My second experience that I want to talk about was with a patient that I had had a previous week, and then I was on for 3 shifts in a row, and this was day 3 out of 3. The patient unfortunately had been bleeding but was too high risk to undertake any surgery to intervene. Myself and the doctor went in and explained this to the family. Comfort care was also explained to the family because at this point it was just a matter of time, unfortunately. So, the family took that very difficultly, as, I would expect anyone to. The patient was losing blood faster than we were putting it in. This patient had about 16 units of blood already. I had given over 6 units during my last 3 days with them. So the family initially said, okay, we'll, go home. We'll get everyone together. We plan on starting the comfort care tonight. I come in the next morning. The family was not there. They did not initiate comfort care. The patient's hemoglobin's 5.5. Their blood pressure is starting to drop. They just look real wiped out when I went in the room to assess them. So I had to take initiative. I took initiative. I called the family. I stated to them what was going on. I said, listen, I know this is a very tough decision, but you need to come in and we need to do this together. So they came right in. We explained the comfort care procedure to them again, and they went ahead and they did it. I told them, I'm here for you. I told the patient, I'm here for you too, even though they weren't responsive to me ever. I still like to let my patients know what's going on. So after we started the comfort care, we took them off the vent. The family was just very thankful for me for calling them in the morning to get them to come in. She said that she was really struggling with, deciding when to do it and kind of needed that push from someone to go ahead and, kind of let them know that it's okay. Like, it's okay, we're going to start this. We need to do it. And they understood that and they were okay with that. So now I can tell you a little bit about my nursing values and my philosophy. So I really value communication with my patients and families. Communication is not only the key to the nurse-patient relationship, but to all things healthcare. If there wasn't communication or the communication is subpar, then there will be important things that we're going to miss, and that could affect patient care. I also pride myself in talking to my patients, whether they can hear me or not, as you heard in those scenarios. It doesn't matter if they're awake, in a coma, in a vegetative state. I strongly believe you need to let someone know what you're doing to them. Another value I have, and what I base my nursing philosophy on, are having strong clinical skills when it comes to assessment and implementation. A keen eye is needed to see changes in a patient that could be a matter of life or death. So making sure that I practice my skills, keep up to date with new technology and learning materials and materials in the hospital is very important to me. Another thing I value is collaborative decision making. I believe patients and families need to know what specifically the doctors believe that the patient's best possible outcome is and what their worst possible outcome is. I believe they need to be involved in every aspect of their care, so that they can make an informed decision. And I believe that myself, as the nurse, I need to initiate this conversation between the doctors and the families or the patient, so everyone can make decisions about their care, so things don't come as a surprise. So that kind of encompasses my nursing philosophy as of now, and that's why I chose to do a video recording of this, because I hope to look back on it in the future, because I know it's going to change. So I'd like to see how I feel 5 years down the line and see what other things I can add to my nursing philosophy. Next up is the 4 ANA Code of Ethics examples that I chose. First, I just want to read a little statement from this article I found online. I thought it was very interesting. It says, an effective ethical code for nursing practice must provide guidance on managing ethical problems that arise at the societal level, the organizational level, and the clinical level. On a clinical level, ethical questions arise every day. In a study of the ethical issues encountered by nurses, they found that more than 60% of nurses identified patients' rights, autonomy, and informed consent as frequent or daily problems. Other common issues included advanced care planning, surrogate decision-making, end-of-life decision-making, and breaches of confidentiality. They explored the ethical issues, the actions, and regrets of nurses, and found that unnecessary pain and suffering, difficult decision-making, and inattention to patient autonomy were very problematic. The Code of Ethics is a guideline for us to follow, but there's still many areas in our community that these ethics don't touch on, and unfortunately they aren't upheld, and it causes a lot of stress for us nurses. We need to address the ethics at all 3 levels in nursing, which is the societal, the organizational, and the clinical level. So the first ANA Code of Ethics that I chose was Provision 1. The nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. So in my practice, I go into my rooms, I validate the patients, I validate the families, I validate their ideas, I tell them I'm listening to you, I hear you, I understand. Just the other day, I had a family member voice their concerns about why they thought their loved one was experiencing confusion. They told me that they were more confused than normal. Maybe they had a UTI. I told her, I hear you. These are accurate thoughts you're having. I'll collaborate with the doctor to see what we can do to try to rule out this concern you have. I also go into my rooms expecting a different scenario for the same disease. No one person that I see I treat the same. I treat them all based on how they react to me. Then I chose Provision 3. The nurse promotes, advocates for, and protects the rights, health, and safety of the patient. So one time I had a patient's mother who was attempting to dictate care for her oriented son, who was completely capable of making decisions for himself. She was telling me that he needs this pain med, give him this med at this time, and the patient was kind of sitting back, just being silent. So I spoke up. I said, "Excuse me, I don't mean to be rude. I would like to just speak with your son. I'd like to know his opinion on this. He can make his own decisions. I want to hear what he has to say because he's my patient. And ultimately, I'm here for him." The next code of ethic I chose is Provision 4. The nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to provide optimal patient care. In my practice, it's my honor to use my assessment skills to help my patients. The other day I came into my patient's room. I noticed that from their forearm all the way up to their elbow was a not so nice looking discoloration. It was like reddish, purplish, and I had not heard about it in report. I looked back, I didn't see it documented anywhere. So right away, I put a call out to the doctor. I wasn't getting a call back, so in about 10 minutes, I put the order in myself to get a stat ultrasound to rule out a DVT. The doctor called back, thanked me for going ahead and doing that, apologized for not calling quick enough. That's why I took, authority and accountability and made a decision to go ahead and do that. And then the last provision I chose was Provision 6. The nurse, through individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. So in my practice, I speak up. If I see someone that's doing something not safe, I speak up and I let them know. I have an orientee. I saw that she was preparing meds without even documenting on the MAR to note the med that she pulled out. So, I let her know. I said, this could be a med error. How do you know what you're crushing? How do you know it's the correct med for the patient? I know what the Omnicell says, but you need to make sure because it's your check to do it again. You're the only person between the patient and these medications that is preventing a med. My nursing goals. I have so many, but I'm going to talk about 3 short-term, 3 long-term goals. So my first short-term goal, I want to actively reflect after each shift. I want to ask myself, how do I feel about the care I gave today? Was there anything I could do differently? Was there anything that made me feel a certain way, like sad or mad? Was there anything that I want to continue doing? Is there something new I learned that I want to keep putting into my own practice? And was there anything I didn't know? A second short-term goal is to be on a staffing or staff wellness committee. And then my third short-term goal is to read, research, and keep up to date with evidence-based practice in my spare time when I'm not at work. My long-term goals. My first long-term goal is to work in an ICU. My second long-term goal is to obtain my adult CCRN. And then my third long-term goal is to continue my education to an MSN or maybe DNP. I'd also like to do Alzheimer's research, and I'd like to do cannabis research studies as well. Completing my BSN will help me excel in meeting these goals by 1, allowing me to have obtained a higher level degree, because that's exactly what's holding me back from being in the ICU, which is the position I really desire. So once I get my BSN, I can go ahead and apply for that. My BSN is providing me with knowledge of being a leader, so I can hold a significant place in a committee for my hospital. BSN degree is teaching me where to keep up to date with evidence-based practice. It allows me to keep continuing to use these resources. It allows me to know where to go to find these resources so I can read them. The BSN helps me get one step closer to achieving my MSN and to do what I want to do in the future. My motivation to stay in this profession. So, my motivation to stay is my interest in improving staffing, improving my nursing skills, improving health promotion and illness prevention, and to continue to spread positivity and smiles around to patients and staff. I want to read another part of the article I found. It says, researchers have found that poor ethical climates were correlated with higher levels of moral distress, poor job satisfaction, and increased likelihood of intent to leave a position. Thus, it is clear that the organizational ethics aspects of healthcare are important factors for nurses. I'm always giving suggestions to my place of work on how we can improve staff morale. I've suggested some get-togethers, some team building activities, a relaxation spot, and venting sessions so we can just all talk about how we're feeling with the patients, with the care we're providing, anything. I'm signed up to take an IV class to improve my own personal skills. I also come home and review things that I don't know, and I freshen up on things if I feel like I'm forgetting about it or I did something that I want to feel more knowledgeable about. I go and look at it when I get home to review. I also run an Instagram account that aspires and inspires future nurses, and I show my experiences and I keep it positive. I smile. So that's a motivation for me as well. So that's my motivation to stay in. As I said in the beginning of this video, I know my nursing philosophy will change over the years, but I'm really excited to watch myself grow and see all that I can do, and then look back on this and add some more things to my nursing philosophy.